Okay, so let's move to Pawel Olko, and he is going to talk about the lesson learned from the Krakow Hadron Therapy facility in a moment. Okay, thank you.
Ladies and gentlemen, thank you for inviting me for this talk. Today we have heard a lot of talks about the fantastic projects and very ambitious. I will tell you about a quite small project, just building a small proton therapy center. However, because it was built not in the richest country in the world or in the Europe, some elements could be of interest for CIS. So maybe some of the conclusions or what we gain, what we learn will be useful for also for your project. What you see here is our research center. It is called Cyclotron Center Benowice. It's not the proton therapy center, but it's really a research center with experimental room and research program. Yeah. Okay. Now it works. Thank you. So this was the story. The story started in principle 10 years before, 1994, in which we organized the first proton therapy conference in our institute. And we were talking over 10 years about proton therapy. In 2004, Poland joined the European Union, and suddenly money came. So it was possible to get some money from the structural funds. And of course, we put immediately application, which was immediately rejected. We put another proposal, which was immediately rejected. But we were fighting, but we were trying to do our best. And finally, we got only 25 million euro. What we can do is 25 million euro. Of course, you cannot build a proton therapy center, but you can buy a cyclotron and build a vault. Yeah. So we decided to take this money and with the smallest money to initiate the project. But then at the same time, we on our own cyclotron, we were starting proton treatment. So the people, the government realized that we are, let's say, getting some knowledge in the proton therapy and so on. So then we got the money for the first country, and also then we got the money for the second country. So we are collecting all together. Our project was 65. But at the beginning, 65 million. But at the beginning, we started with only 25 in the pocket. What we got for the 65? We got cyclotron, which is here, I built cyclotron. We got experimental room. We got eye treatment room. The eye treatment we did ourselves. It is our own construction. And we got scanning gantries. So it was, I think, a good, of course, and a work of maybe 40 people from the institute for several years. That was the price for the project. So this is the 20 years experience in 20 minutes. I'm trying to why the project was happening in Krakow. What was the key elements of the project? In patients and research, and finally lesson learned. And you see, that's the most beautiful moment of each project. When you put the first concrete, yeah, and then you think everything is running fantastically. But as Winston Churchill said in the beginning of the World War II, and now you can expect only blood, tears, and sweat. You don't expect anything more. And that was the case. All the problems started in the same moment. Okay. So why we apply for proton and why we were successful? Of course, this was a very good comment that you need to have different institution. And my institute is the biggest institute of Polish Academy of Science with about 600 of people. And it was important. It was not a very small group who are already known in Poland also in. We had a connection with high energy physics, nuclear physics, dosimetry. We had a big workshop with technicians, engineers, and we also developed the one with the cyclotron, 1995's first cyclotron was 60 MeV, which we later used for the eye treatment. We also had experience with the hadron therapy with the neutrons. In 1978, we started treatment with fast neutron beams. We had about 500 patients of the advanced head and neck cancer, and the therapy was stopped in 95. So we had already contact with the medical world. The medical world, they believed us that the collaboration with us could be fruitful. And what we learned from this first part, how to work with the patients, and also in that time we built radiobiology and dosimetry team. Then we are talking about, as I told you, first proton therapy 94. We already that time were talking about the eye treatment. Why eye treatment? Because in Krakow, there was the clinic which collected all patients for Poland, about 300 patients per year with the eye melanoma, which was coming to Krakow. So it was a fantastic coincidence. We had 60 MeV cyclotron, there was the clinic, there was the discussion, we had no money, of course. But finally we got about €1.5 million to buy this chair, to build, to build some very simple instrumentation, to get support from the agency, Stanisław Bartnicki and from other colleagues from Berlin and Flatterbridge. And for about €2 million, we started to treat eye melanoma patients. We treated with this simple stand 126 patients up to 2016. In 2016, we moved the treatment to the new facility. What were the two elements of the project? First, we had to convince our colleagues from other places to support the project. So we included the key players in Poland. What are the key players? The biggest university, Warsaw, Krakow, that's the first. The biggest polytechnics and the biggest oncology centers. So all directors of the oncology centers were meeting every half a year over several years. So they were informed, they could speak, they could express what they wanted to express. But there was another trick in addition. I don't know if you know, but there was a plan to build also an ion therapy center in Warsaw. So the deal was small proton therapy center in Krakow and a big ion therapy center in Warsaw. There was even construction plans and so on. Finally, there was some changes in the oncology and the medical university there. They didn't follow this project. But we got support from all the Poland. All the opinions that we were getting, so reviews were always very positive, and that was because of this existing of this consortium. What else? We offer very good location, close to the highway, close to the railway, close to the 10 kilometers to the international airport. So it was perfect. We serve everything, and we also have space. Center of Oncology in Krakow was in this middle of the city. They had no possibility to build their proton center, and we had enough space, and we used this opportunity. And of course, money, which is the most important. As I tell you, we got all together 65 million coming in 3 parts. It was fantastic, but it was a nightmare because we had first building permit, the second building permit, the third building permit in a few years. So all the time, enormous work involved from the environmental studies, radiation protection, and so on and so on. So, of course, we got money, European money, but of course, what are the cons? Complicated bureaucracy, very unclear regulation, all this, all the time, all this. So, when we already came to the tender specification, because there's a public money, then we got a lot of help. We got in touch with other people who already did it, from Uppsala, from ORSEF, from IAU, we got a great help. So we know what we want really, and what are the problems in the technology which is offered by ABA. So one of the problems was what type of technology to take, because our tender was 2011. In that time, no one decided for that. There was no treatment planning system in that for the scanning. But we decided for for the PBS. And it was finally a very good decision because at the end, we ended it with a modern facility, which is now, up to now, is very modern and working well. What is additional problem? When you build yourself something CE marking, the facility was IBA, but the I line was developed by our team, by our engineers. We spent really 2.5 years for making the CE marking. About 10,000 pages of different documents were prepared for that. So this is the warning. You build your facility, but if you have to make the CE marking and so on, you'll need a lot of time and a lot of competent people who are able to do it. Build the team. I go very quickly because I see only some 5 minutes which left. You know how to do it. So we went, but of course, at the beginning, we say the people should be trained by vendor. So we have our own technician who operates and also maintenance cyclotron. We have only one IBA guy on site. Everything is done by our engineers and technicians. And because we are a scientific institute, there was a lot of people. You see, when we put the cyclotron, there was hundreds of young people who wanted to work with us. It was said by you. Put the cyclotron, make the beam, there will be a lot of people who wants to work with you. And that was the case. So a lot of young people wanted to make PhD. And so in that time, for the last 10 years, I had 15 PhD students who completed the degrees. Of course, with the patients, you can work only when you have specialization in medical physics. In Europe, it is not commonly recognized. So in one country, you cannot work easily in the other country. However, from the beginning, we put our physicists to have the training and having specialization in medical physics. So finally, the team was built. There was altogether about 50 persons plus administration. So from people, so our engineers from Proteus, and 3 people from IT, eye treatment 4 persons, dosimetry QA 8 persons, therapy planning 9 in medical physics, radiation therapist 12 person, quality control, secretariat, altogether about 50 people on the board. So patient treatment and report. We are not medical institutions, so the treatment by 2 institutions. One was they were collecting patients from all over Poland, and the eyes from the University Hospital. As I said, all melanoma patients are coming to us, and so they are treated. They doctor, they come with the patients to that. We are responsible for the machines, for QA, for dosimetry. What is treated, it changes with the time. At the beginning, the indications which were financed by the National Health Fund in Poland was very limited. It was growing a little bit, We had a lot of problems, like, for example, our regulations didn't allow us to take the private patients. And of course, also, as always, reimbursement didn't follow inflation. But finally, now, when we are treating more than about 350 patients per year, we got some financial equibalance. So what was the beginning was very hard. It started from about 70, 80 patients, but in last year, the 23, 312, and then this year will be about 350 patients. We are treating about 50 fractions per day. Also, we came back also to treating the children, because at the beginning we treated children, then there were some problems between institutions that couldn't refer the children. So now it came back. Now we treated more than 1,500 patients. But of course, as I said, it was not built as a proton therapy center. It was built as a research center. So half of the area are the utility rooms and laboratories. 2 laboratories for physics, 2 laboratories for radiobiology, separated experimental area, and a lot of equipment which is there. So we also have the International Advisory Committee, which approves the plans of experiments, and we hosted here in our institute several EU-funded transnational access projects. So that's also when altogether we had about 250 scientists from 35 institutions, 16 countries, which came for the experiments in our project. What we are doing similar things that as is done in other centers, 45 seconds. So radiobiological studies, dosimetry, for example, development of the 2D, 3D dosimetry, patients processing a range monitoring, grid therapy, 2D granted compensators, and so on. Lessons learned. So the last seconds wish list, but maybe we can take the seconds to read it. It is important that the project is located in a stable institution with sufficient resources which could be used in case of problems, crisis. Experience in the institution in handling of the big projects is essential. So we need to have the lawyers and all the things behind. Presence of experts in operation of accelerators in radiation physics protection detectors is very useful. Collaboration with all partners around. Win-win situation needed to select the central location. Exactly. We got on we got the agreement to locate in Krakow because we offer also others many things. Training at different levels by research, specialization, collaboration, and so on. Leadership of a physician, radiation oncologist with a strong personality and position is crucial for the success of the project. However, the most work will be done anyway by the physicists. That's clear. Critical task selection of the technology. When we select technology now, the center will start in 5-10 years. Build yourself or buy. The big problem of the medical CS certificate. Buy when only possible. If you do it yourself, you'll be prepared for medical certificate. Work early on the financing of the therapy, indications, patient flow in agreement with conventional therapy. Involve physicians and physicists from many centers and help in the careers project internships, common patient data. Thank you a lot.
Thank you very much. It was really interesting. And any question from the room? I have a curiosity. I saw that you jumped from 177 patients in 2022 and then to 312 in 2023. What happened?
What happened? 100 kilometers from Krakow is the Gliwice Oncology Center, and the guy from the Gliwice became a coordinator of the main specialist of the radiation oncology in Poland, and he decided to bring their patient to Krakow. And also, because of some organization, he became director of oncology center, so immediately brought additional 200 patients.
Okay, thanks. And I have another question. I mean, from this experience that you were born as heavy ion, I mean, you were supposed to be a heavy ion therapy center, then you moved to a proton one. Are you now missing carbon ions or?
There is Gliwice, so the Gliwice they were still talking about the carbon ion therapy now. So before also now Gliwice. Of course, there is the problem of money now. Now the political situation changed. We have the Russian aggression of Ukraine and all the consequences. We spend now 5% of our national budget for the arms. So that's the much more difficult situation.
Just from the money that we know, from the clinical experience, do you think that now you are ready to move to the carbon?
I cannot answer this question. Sorry, I'm not competent to answer this.
And then there is a question there on the chat. And do you remember how much did the IBA synchrotron cost? Less than 10 million, from 10 to 15 or 15 to 20?
Yeah, I remember all numbers. Of course, no, it's really, I remember. I can say, I think the cyclotron alone was about 18 million euro in that time, 17,500 something. Yeah. The IBA and Varian, but Varian finally didn't want to jump in such a project which could be in pieces. Yeah, so they don't. So that was the price, but it was without the building, without the bunker. At that time, the construction works in Poland were relatively cheap. Yeah, so 20 years ago, so we could for about 25-30 million have the cyclotron and the bunker with the experimental room.
Okay, thank you. Any other question? Okay, so we have finished with the presentation, and I'm supposed to do some Actually, I'm supposed to do some concluding remarks, and apart from thanking all the presenters, I was thinking that we have in Europe, we have a really wonderful situation that we have many centers. They are quite close each other. And probably for the next meeting or the next workshop, I would encourage also to organize something related to the collaboration among the centers. I mean, we have seen today the activities for each from Heidelberg, GSI. It would be also nice to have an overview of what is happening among the centers. So the research that are going on in collaboration, because some centers are actively collaborating, and that would be really nice also to see that it's not easy, but that some network is existing in the research field and hopefully also in the clinical one. So that is my recommendation for the future. Maybe it would be really nice to see that we are also working together. And I think that it's time for coffee break. We are